This is San Diego's more local news station, KUSI News.
One of the most popular plastic surgeries is also the one with the least downtime. And we're talking about getting rid of that little double chin that's been bugging you, I guess. Dr.Jeffry Schaefer joins us with his patient, Joey, who's going to talk about the fact that you had it done and you did it and who's doing it, and how much it costs, all that good stuff. Good morning.
Good morning.
How are you? Good to see you.
Good morning.
Do you go by Joey or Joseph?
Either one. Doesn't
Okay,
matter.
all right. So, Doc, let's get the specifics first of all. Who's getting this done, and who should get it done? I mean,
well, basically, it's anybody that's unhappy with their neck. Usually what happens is someone takes a picture of your side of you. Because we're used to looking in the mirror saying, I look pretty good. And then someone takes a picture from your side, or there's going to be some wedding pictures, and people decide that they don't like the way their neck looks. So this is mainly just a neck procedure to tighten it, to give you a smaller, quicker recovery, so that it's done in a short period of time of a couple days.
now, what does it entail? I mean, basically, you make an incision, right?
Yeah, we actually have an incision on Joe that's somewhere about 3/4 of an inch. We lift the muscles up. We take all the fatty tissue out. We sew the muscles together that are hanging if you have those bands or straps. And then we take the laser. The laser tightens that area, like putting bacon in a microwave. Oh. So it's kind of fat and chunky, right. And what everybody wants is a tight neck.
This is appetizing. Let's show the pictures. Okay, Joey, you're brave to show the before pictures, aren't you?
I was under anesthesia already at that point.
Oh,
so.
you were. So you were a little looped, is what you're saying. Okay, well, look at the after. Oh, the before. All right, there's the before picture. So you can. So basically, what you do is with Joey. I mean, he's still a young, handsome guy. It was actually just some fine tuning, huh? Because you look at him now, and that you don't have that little pocket right there.
No, not
that's
at all.
basically it. Now, why did you decide to do it?
It was something that had been bothering me for a long time.
Really?
And then fluctuating with weight, so just something that was kind of there and wanted to get rid of.
Yeah, and so now, do you look at it all the time from the side? And, I mean,
no, I don't even notice it anymore, but I do notice it when I see an older picture of myself, and I'm like, whoa, that was me. So it's definitely a vast improvement.
Yeah, how much downtime? How long were you out?
I was out for 2 days, and then I went back to work on the 3rd day.
Really? And then did you have bruising or swelling or anything?
I had a little bit of bruising, but very, very slight, and no swelling hardly at all.
Wow, that's wild. Let's show a couple of the pictures. You can kind of walk us through these ones, too, and show us what you've done. Okay, look at this before and after.
Well, this is a much older person who, once again, most women are more demanding, and they want a bigger operation. She was very happy with the same one that Joe had. She's thinner, so but we get the neck tightening, and this is all that money that she wanted to spend. She didn't want to spend 6 weeks at the Beverly Hills Hotel recovering, looking like a pumpkin, and so this fit her budget. This is a gentleman the same way, where a little older, had a situation where he had younger men competing for the jobs in the office, and he wanted to have a more youthful look so that he could compete and not get pushed out early.
Is that genetics when your chin just goes straight down like that, though, or is that weight gain?
It's a combination of both. I mean, basically the shape of your body, the color of your eyes, a lot of it has to do with genetics. But some of it, people gain fat in that area. And
so basically you just go in and you just tighten it up, suck it out, and sew it back up.
Exactly. 20 minutes.
20 minutes. How much does a procedure like this cost on the average?
Yeah, we're looking around $3,900.
Okay, and then do you stay the night in the hospital?
Oh, no. You go home.
Same day.
Same day. So it's a same-day procedure. What is it? Here's the information, laserlift.com. People can find out more from that website. Okay, and the phone number, 1-800-810-5449. If it's something that you're looking into, what's the number one requested plastic surgery?
Liposuction.
Liposuction.
Of which this is a variant.
Oh, so is that to mess it when they just sort of, it's a smaller tool and they spot reduce areas?
We use smaller tools, but tumescent is actually filling the area with fluid.
Oh, okay.
So that you bring the fatty tissue out in the patient's, in your fluid rather than their blood. So they don't have any blood loss, so they can return to work early.
So liposuction's the #1 deal, huh? Interesting. Thanks so much for your time.
Oh, our
and Joey,
pleasure.
Thanks for throwing it out there.
It was great to bother you.
I know you're so brave to come on and show the before and the after.
No worries.
Is it true that some people say once you start and you do one thing, you'll want to do something else?
I don't know. It's kind of like on your mind. You think about it. You think, well, if that was so easy, then why not fix this too?
Right.
So I'm kind of thinking about it.
Yeah, just somewhere in the back of your head.
Of course, always.
I know. All right, thanks so much, you guys.
Thank you.
Appreciate your time
Susan.
this morning. When we come back, we'll take a look at today's top stories, of course, so stick around. We're just getting started. Good morning, San Diego.